This is Kaz Aston from the London MS Clear Guide team, and I'm here with one of the world expert bariatric surgeons, Mr. Humadi. Thank you so much for talking to us.
It's a pleasure.
I understand there's lots to talk about, and obviously I want to talk about MS and diet and bariatric surgical options because we've had a lot of questions about that. But I think the most exciting thing for me is the latest research, and I think you've got to tell us about this if you don't mind.
Well, as you know, Kaz, the MS etiology is multifactorial. So although we think there is a genetic sequence, for the problem, we know that there is a lot of environmental factors, like, for example, smoking, infection with some viruses, low vitamin D. Now we know that obesity is another factor, and recent research has shown that obesity cannot be ignored as a causing factor of MS.
Wow. Because that's a big thing with MS. It's always, well, is it vitamin D? Is it Northern Hemisphere? Is it? And we know that certain things with MS, symptoms of MS, when MS is active, spasms or pain or different medication, opiate, analgesia, can all affect your weight. So, all of this going on. So have you got some ideas that people with MS can think about or some ideas that they can incorporate into their life?
Well, it's weight loss surgery, really, not necessarily surgery. Losing weight definitely would help with MS symptoms, especially, the fatigue and weakness. And if you are less depressed, and majority of people are depressed because of the weight, you will take less antidepressants, and that will help again with your mobility.
So all of this research has just come out. So seeing it in practice now, I know you've seen a lot of MS patients and you've talked about some of the strategies that can help them. And I think that might be useful because you've got a whole team of nurses, that work together with MS nurses, for example, but you've also got bariatric specialist nurses, dietitians, all of this team working together. Then you give patient options together, you work for solutions that can help. Can you tell us a bit about that?
Yeah, it is a teamwork, really. It is not, if we're talking about surgery is just a tool to help. So it's the support that they will get from the dietitian, from the physician, support that they will get from the specialist nurse. It's a teamwork. And on the top of that, patients have to do really their bits. By complying.
Because it's lifestyle changing, isn't it? It's not just sticking to the diet. But are there any top tips that you can give people with MS to think about when managing their diet?
Well, from the dietary point of view, we know that vitamin D is a factor. We know magnesium is a factor. We know vitamin E now is a factor. And we know obesity is a factor. So by losing the weight, people will... symptoms will improve. And we know now about cholesterol as well. Right. So, yeah, blood lipids are very important as well to bring in, to get blood cholesterol down. Symptoms will improve in MS, and this is the recent research coming from Australia.
Can you tell us a little bit about possibly the surgical options and what it might mean for your lifestyle?
Well, surgical options are either simple options, which doesn't involve, any cuts, like putting balloons in the stomach. And we do two different types of balloons, one filled with saline and one filled with gas, nitrogen. Okay. And they can stay in the stomach, for 3 to 6 months.
Is this a tablet that you just swallow?
Yeah, one of them is the capsule. Okay. You swallow it, and it stays in the stomach for about 12 weeks. Right. And then we take it out. The other one is saline filled, so I do it with, endoscopy and fill it with saline, and it stays in the stomach for no more than 6 months. Right. On average, patients lose about 20 to 30%, sometimes more of their excess body weight with the gastric balloons. Then you have the other surgical procedures, which are either gastric band, gastric sleeve, or bypass. It depends on a patient's eating habit, depends how much weight they want to lose, and the starting weight.
Yeah, I mean, there's been quite a bit of negative press about gastric bands and things going wrong. I mean, it's even featured on mainstream television, the soap opera as well. This went wrong. She went to a country to have it done. It was cheaper. I mean, can you tell us about possibly some of those experiences for people to think about? Because people look at options. How can I do this? I could go there and have a gastric band. But have you got any experiences in reality that you can share with us to help people make the right decision?
Yeah, I mean, generally speaking, if you have someone who's a volume eater, they rely on their calories on eating big meals. Then they restrictive procedure, which means restrict the amount they can have, either in the form of gastric band or sleeve will be ideal. If you have someone who rely on their calories on, let's say, picking or sweets.
Or alcohol.
Well,
or social life, possibly.
Yeah, then bypass might be the option. The band is a silicone, from silicone material. Right. It's like a belt. You put it at the top part of the stomach. So the stomach will be like two stomachs. Right. Small one at the top, we call it pouch, and the bigger one at the bottom. Right. And then the band is connected with a tube, and the tube end up with something like 50p. Right. Excess port goes underneath the skin. Okay. So if I inject fluid in that port, the band will become tighter. Right. If I take fluid out, the band will become looser. And the whole idea really is to reach the level that the patient can eat normally and at the same time lose weight. The problem with the band, having the band outside, is the follow-up really.
Yeah, because so people talk about bands on flying, that they're having, because a lot of people travel with work and such like, and I've heard this, that you have to have lots of fine-tuning done to it.
Yes, if you are flying, the pressure in the cabinet will affect the band. So I advise my patients to have their main meal before flying and stick to fluids on the flight. Right. And then when they arrive, they can go back to normal.
Right, so there's a solution for everything here. And so if people want to find out about how to move forward, if they've been on different diets and it hasn't worked, or they just really want to actually try and take charge of their life and sort their own balanced lifestyle out, what do you recommend they do? Talk to a GP or go online? How do you think it's the best way to go forward? Yeah,
I think talking to a GP is a very good starting point. Please don't go on websites that you cannot verify. It's very important really to go on respected websites and look for consultants with track records.
Thank you, Mr. Humadi, for sharing everything today that you have about bariatric surgery, possible help for people with MS. It's been fantastic. But most importantly, shared some really cutting-edge research that's just come out in the last couple of weeks. So thank you.
Thank you very much, Kaz.